we'll look at the Cullen's sign, and this is kind of like a sign that will guide you on making diagnosis, okay, for issues related to, will I say, damage or injuries in the abdomen. Okay, so this is what is known as a Cullen's sign. Alright, Cullen's sign just simply means there's a discoloration here. Don't worry, in the lecture we'll describe it much more proper. Okay, so don't mistake Cullen's sign for great Turner sign. Cullen's sign is usually around the umbilicus. It can be slightly above it or down towards the pelvis, because sometimes some pelvic issues can also give the Cullen's sign. So we'll describe it and also talk about conditions where the Cullen's sign is associated with. So first, you should know that it's a bluish or purplish discoloration. This one is purple, while this one is bluish. Okay, so usually occurs around the umbilicus, and it indicates that the person has bled underneath that place. Okay, so commonly we'll talk about the causes, don't worry. Okay, the association. All right, so appearance, the bruising or swelling around the belly. If the injury was from outside, you see some bruising, but if the injury was totally from inside, you just see only swelling and discoloration. So it's actually blood from the retroperitoneal or intrapenial space that is tracking through the tissue planes to the skin around the umbilicus. So it's associated with what? Acute pancreatitis, ruptured ectopic pregnancy, which is what actually brought us here as a gynecology channel, right? Then blunt abdominal traumas, ruptured abdominal aortic aneurysm. That sometimes is esophageal cancer, but it's rare. So this sign was named after Thomas Stephen Cullen, who was the first person that described the relation of this sign to somewhat pathologies, right, in 1916. So though rare, it's actually a red flag that the bleeding was so severe. Do you understand? Bleeding was so severe, and you actually need imaging so that you can furthermore localize the issue underneath.